Instill knowledge in us. Start by invoking Goddess Saraswati. I would like our dignitaries to please come up on stage to light the lamp of knowledge while we pray. May I call upon Madhura Joshi to sing the Saraswati Vandana.
हारधवला या शूद्रवस्त्रायुता या वीणावरदण्डमण्डितकरा या श्वेतपद्मासना या ब्रह्माच्युतशङ्कर प्रभृतिभिर्देवैः सदा वन्दिता सा मां पातु सरस्वती भगवती निःशेषजाड्यापहा शुक्लां ब्रह्मविचारसारपरमा आद्यां जगद्व्यापिनीं वीणापुस्तकधारिणीमभयदाम् जाड्यान्धकारापहा हस्ते स्फाटिकमालिकां विदधतीं पद्मासने संस्थितां वन्दे तां परमेश्वरीं भगवतीं बुद्धिं प्रदां शारदाम्.
We have gathered today to hear an interesting and engaging talk on pain management and Ortho-Neuro rehabilitation through Keralya Marma Chikitsa. We are honored to host an expert in this field, Dr. N.V. Shreevaths, an Ayurvedacharya with over 30 years of experience. Our president for today's talk is Dr. Shreevaths Agarkhedkar sir, Chairman, Local Management Committee at D Society's Brijlal Jindal College of Physiotherapy. We also have with us today Dr. Girish Tillu sir, a renowned researcher working as the principal investigator at the Ayush Center for Excellence, along with discharging his duties as an assistant professor at the Department of Health Sciences at the Savitribai Phule Pune University. Dr. Tillu started his research career more than 20 years back as a senior research fellow at the Interdisciplinary School of Health Sciences, SPPU. He subsequently worked with the Center for Development in Advanced Computing, CDAC, on the development of IUSA, a project that consolidated the vast knowledge base of Ayurveda. Sir is currently involved in research in Ayurveda-based adjuvants for COVID-19. He leads the research group at the Center for Complementary and Integrative Health, and he was instrumental in arranging today's session. I request Sir to please introduce our speaker for today's gathering.
Thank you very much. Good afternoon and welcome to this session. A session on Ayurveda, and that is being organized in a physiotherapy college. Actually, Ayurveda is science of life. It touches various domains and walks of life. Hence we thought that this session can be hosted in this college. And our mentor and patron, Professor Agarkhedkar sir, he kindly agreed for this session. If we want to introduce by the Shreevaths sir, his formal introduction is a professor of Ayurveda who had been leader in Keralya Marma Chikitsa. He was director and principal at Ayurveda College Coimbatore and various Ayurveda institutions. But more than that, his introduction is, when we meet him, we get a feeling that Charaka's verses of an ideal Vaidya we are seeing those qualities in him. He was instrumental in development of a very new field, that is Marma Chikitsa coupled with sports science. He was also instrumental in taking this particular knowledge heritage on Marma forward. When we were discussing, he told me that there are more than 350 books on Marma Chikitsa in a district of Kerala. Friends, when we know more and more, we actually know how less and less we know. But we are really amazed when Prime Minister Modi signs the mother of all deals with European Union, and one of the agreements in the deal is exporting Ayurveda knowledge base, exporting yoga for all over the world, which world looks for this Indian knowledge heritage. We are very much fortunate to have Professor Shreevaths sir here. His life mission is to propagate this Marma. Friends, when we encounter several challenges in practice, there are many innovative approaches in Marma Chikitsa in various parts of Ayurvedic knowledge base. When we learn Marma, we start thinking that we know very little about our own self, and there are so many things that we need to learn and explore. This gathering is very interesting gathering, and we have very senior practitioners and researchers. We welcome Professor Rajwal Rao from D.Y. Patil Medical College, who heads the neuroscience department. We also welcome Dr. Preeti Abhyankar, who is the chairperson of local managing committee of Nursing College. A defense scientist, Mr. Arvind Pansode, is attending this talk. Senior scientists like Sarika Chaturvedi, senior Ayurveda practitioners, Dr. Ranjit Jadhav, Dr. Yogesh Karmarkar, Dr. Nilima, they are in gathering. And most important, this talk is for all of us, but particularly for my student friends. So friends, please ask questions, and I'm sure this interaction will be very helpful and successful. To begin with, we would like to felicitate by the Shreevaths ji on behalf of Savitribai Phule Pune University and from the ES Society. And on behalf of Center of Excellence, I would request Dr. Sarika to felicitate by the Shreevaths ji. Please. On behalf of Savitribai Phule Pune University, we would like to felicitate Professor Agar Kedkar sir. Agar Kedkar sir is also involved in Ayurveda research, and he has been one of the authors and contributors for development of a protocol for Ayurveda massage being implemented in infant. Professor Agar Kedkar has almost vaccinated half of the Pune's population, I think, and we would like to felicitate him, sir.
May I ask the dignitaries to please assume seats in the audience? Sir, please start with your talk now.
Namaste. At the outset, let me pay my regards to my gurus, Dr. G.S. Raju, Dr. J. Chandran, Dr. Mohanlal sir, and Dr. Chandrasekharan of the Vertical Ayurveda College and Trivandrum Ayurveda College, where I did my graduation and post-graduation. My acknowledgements, thanks to the organizers for having invited me over here, especially Dr. Girish Tillu and Dr. Sharad ji and all who have been instrumental to be make this an occasion for me to meet you all. And there are scholars who are there in different fields from neuroscience. We have the leaders, academic leaders from this institution, and we have my dear students are here. Always students, anywhere, everywhere. You are the people who make us take the subject to you. Welcome all, and what you are expecting, I don't know, but what I have to tell, I will be telling in this. It was, Girish sir told that it was a 1 hour session. I told that maybe I have a habit of speaking more. So I think at what time I will have to stop that if it is told. One challenge was that if I was speaking to the Ayurvedic community only, already they are introduced to the subject and then you can just go on to the clinical aspect of it, etc. Now we have one good thing. I had been working with physiotherapists. I was as a principal in the Coimbatore Ayurveda College. We had in the campus the physiotherapy college also, and maybe I don't know whether you know Dr. Kannabiran and other people in Coimbatore who are this thing. And way back in 2010, the Ayurveda Medical Association of India and Kerala had organized a joint integrative Ayur Physiotherapy conference, in 2010. It was a 2 or 3 day sessions with inputs from both Ayurvedic Marma practitioners as well as traditional healers as well as the physiotherapists. I am very glad that Dr. Sharad was instrumental in that massage therapy or massage protocol for the children in their growth and all. Kerala is proving well in pediatrics also, especially milestone delayed cases and all. And I heard that Shalak madam is from Shalakya. So I tell that Marma, when once it is known, then it is useful in all the 8 branches of Ayurveda as in a clinical situation. So usually Marma means itself. Is there any in Marathi? The word Marma conveys anything?
Yes.
What is that? And I believe in something like interactive rather than a presentation. So Marma in Tamil and Malayalam and all have the Marma means the core point. It's a mystery, something hidden. So always when I talk, I tell that, dear students, do you want to be like Sherlock Holmes? Do you want to be like Agatha Christie? You have to, because generally people are there in your clinic. It's a straightforward, this thing you are getting wins, it's okay. Like you have the signs and symptoms, you diagnose it. But something is eluding, something is this thing, how you will catch with that? So then you will have to have an inner eye, or you will have to be intrusive. You will have to know that. And it's very difficult to cheat or deceive a Marma physician, do you know? If somebody is coming with some problem, then you know that if somebody, a woman comes and cries to you that, okay, I fell down yesterday, and you find that you have the ulna is broken, and you know that she tells that I fell down yesterday, and are you going to agree? No. Second question from our side is like a policeman, like, when did your husband beat you? Because you know that it is a stick injury which has been sustained over there. So I was just talking to sir that more of Marma is related to functional anatomy. It's not a dead anatomy. Marma we are talking about the prana. And the prani is the one living being. Without prana there is no sense of Marma. There is only the sight of Marma. Okay. So with that basic thing we will go into this, in between we will be talking. I wanted to make it that, okay, it passes to the physiotherapy students also, to the other practitioners also, and then come into Marma, describe it a bit, and then what is Keralya Marma Chikitsa. Keralya Marma Chikitsa is not just with power pressure points, acupressure points like that, but it is actually using all the modalities for treating any abhighata, any injury to the vital areas of the body. So there are some areas which are very, very important. Every time I start with that only, how many of you know that you have marmas in your body? Everyone knows that you have blood, you have muscles, you have nerves, you have bones, etc. But how many ligaments, etc. But how many of you know that you have marmas in your body? You know that Ayurvedic people will be accommodated to that question. So it is there. There are some areas in our body which are part of the same muscle only, same ligament only, same nerve only, but they are vital, we call it, because they are very important, and if you give some pressure over there, there is pain also. They are pain sensitive. They are more pain sensitive. Maybe that area is. Pain is a reflection of what? Protecting your life. So that way you can understand that they are lifetime also. For example, shall we do with an exercise before going there? Now, can everyone? I will give instruction. Can you shut your eyes and then? Usually, then I can get out of this one also. Because there is no need for teaching one. Whenever you are having a headache, naturally you will be doing something, isn't it? You don't go and search for paracetamol at the time or this thing. Immediately on the table you will be doing. So, imagine that you are having a headache. Now shut your eyes. Whatever you do, usually whatever you do, sir, I will go for Zandu bomb, sir. That's it, what you will be doing. That you do, and then don't open your eyes. When I ask you to open your eyes, don't move your hands also, or whatever you are doing, continue to do that, and we will see what happens. Okay, you are having very severe headache. What you do, usually you do. Now don't move your hands, just look at what others are doing in that row. Only one thing I know, that some of them could not imagine a headache. So they were somewhere into, like Girish sir, into deep meditation. And this is one. But commonly what did you see? What did you see? Everyone was going for the sides of the forehead and then putting their fingers over there. Some would have imagined very severe headache, they would have pressed it. Some might have had imagined one-sided headache, so one side only they would have pressed. Okay. Now, did your mother tell that, okay, when you grow up, you will have headache now. So at that time you should take this hand here, you should place it here, and then the headache will subside a little. Did your papa teach you? Did your school teacher teach you? Or in Ayurveda colleges, did the Ayurvedic teachers teach you? No, from where it came? You are not talking, no, I will be doing this one, you will be doing that. Did you? No. So you are actually doing it on your own. So I will put it as Marma as the inherent intelligence within your this thing to correct itself. Whenever there is something wrong going on, whether it is excessive function or deficient function or abnormal function or a pooling over there, to correct it, whatever it is, you will do that. For example, after if I make you sit for 2.5 hours here, your university exam 3 hours, after that what all you do? She is good. Show it. Right? First thing you do, like put the pen down, because part A, one question is to be answered, part B, you know that last 10 minutes will be there, at that time only you will be tapping your Ajna Chakra. Then suddenly the answer flows, you start writing. By that time the teacher will pull the paper. Done, because if it is the last exam, then done. Put the pen down, then until that time you have put the vata, the flow of everything into this one. You have been straining your neck, so next thing is that, is it not? Tak. Why you are doing that? Why we are doing that? And then get up and then, how? Is it not? Your hand will go directly to these two places. So that's what I told, that once you realize that it is your body will show, then you know that you can understand, okay, these areas are crucial areas. Got it? So as physiotherapists I tell that you can, when the patient walks in, then you can imagine that, okay, where he has put his hand, where he has this thing, why it is happening, where it has to be corrected. Okay, this is the core of the Marma Chikitsa. So now we will go into the topic. Okay. Now intersection, we are in an intersection. No? Girish Sidhu sir has put me into that. This one where all people are meeting. Physiotherapist is there, the Vaidya scientist is there, the ordinary Vaidya is there, the academic Vaidya is there, students are there. So the place where two or more roads, lines, etc. meet or cross each other, that is what is happening in integration. No? Now in our society, everything we have integrated, and a watertight compartment will be good for keeping the core principles of that any subject. But when it comes to Vyavahara, we call it, when it is in Tattva, you have to have your theories, Tattvas. When it comes to Shastra, how it has to be interpreted, then that is there. When it comes to Vyavahara, then practice, you know that we are living in an age, even though I am Indian, I was a colonial Indian, so I am also wearing this fan shirt and all. Okay, we accept it. Like that, when coming into practice, that has to be. So that is where the integration possible, practical integration can be brought out also. Okay. Now, examples of old theories regarding health finding significance in modern era. That's what the thing, no? So just, we'll have a quick view on that. Ayurveda is in traditional medicine. Concept of doshas are there. The ancient systems of medicine, Ayurveda, describe the concept of doshas, that is Vata, Pitta, Kapha, which relate to individual constitution and balance. The balancing of this Vata, Pitta, Kapha is supposed to be maintenance of good health. Swasthada is Samadosha. Modern relevance, modern research has validated the importance of individualized treatment approaches, and the concept of doshas has been linked to modern understanding of genetics, epigenetics and microbiome, which is the core of Ayurveda biology, which is happening with the starting from Dr. M.S. Valyathan. So I was telling that when Dr. M.S. Valyathan was the head of the Sri Chitra Institute of Medical Science and Technology in Trivandrum, some of us were the people from Ayurveda who were trying to get into research in this one, integrating these subjects. Next, please. Traditional TCM is more popular than Ayurveda. You know that because 50 years back, what has to be done, they did. We were late by 50, 60, 70 years. So TCM is very acceptable, whereas Ayurveda is still not. As far as US, anybody is associated with US medical, this one, they know that. You have to go on proving. Whereas TCM has in WHO, the traditional medicine is headed by TCM. So you know that in that concept of chi or the prana describes the concept of chi, a vital energy that flows through the body. Modern relevance, while the concept of chi is still not fully understood, where for you only I am putting these slides. Prana is not understood. Modern research has shown that acupuncture, a key component of TCM, can have therapeutic effects on pain management, inflammation and other health conditions. Just we can change that acupuncture into Marma Chikitsa. Okay, you know that the same thing is there in this one. Many a thing is not revealed, many a thing is not, we don't know now to explain, but that is where the work of the intersection has to come. Next, please. Humoral theory, you know the four humoral theory of the Greek medicine, shown that maintaining balance of hemostasis in the body is crucial for health, and the concept of humoral theory has influenced the development of modern endocrinology and immunology. Now we tell that now we cannot, Rao sir is here, neuro-immuno endocrinological situations, like, which is, those who learned Ayurveda will know that put the this one of Sadhaka Pitta, the whole thing is explained like over there. It is not just the metabolism, it is the buddhi, meda, abhimana, abhipredartha sadhana, Sadhaka Pitta has the influence on all these things. So it is a way it has been put, so that is one thing. Next, like importance of physical activity, you know that it was very, very, Greece, you know that physical activity was given. In Ayurveda also, Vyayama is given. Modern research has confirmed that. So we tell about Ahara and Vihara in Ayurveda. Ayurveda don't think that it is only herbal medicines, mineral medicines, etc. Food is one thing, the way you live is another thing along with that. So activities are mentioned, who should do more activity, who should do less activity, etc. So exercise for preventing chronic diseases, improving mental health and promoting overall well-being. Now we talk about lifestyle diseases and the role of non-medical interventions in that. Is it not? Non-medical interventions are more important in such cases than this one. And as far as one thing I tell you is that wherever you are going and you are not permitted to use any pharmacological agent, there Marma Chikitsa helps. That was the way it was, non-pharmacological intervention for relieving pain. Like that it can be utilized. Marma Shastra, Marma science is an ancient Indian science medicine based on Ayurveda and wellness that originated in Ayurveda, or is a part of Ayurveda. Key principle, Marma areas. So for your purpose only, Marma areas are specific anatomical locations on the body that are believed to be sensitive to touch and pressure. So there it is very sensitive. I'm not going for examples, but you can understand that. Vital energy. So there are some points which are connected by the vital energy. Marma science is based on the concept of vital energy, prana flowing throughout the body, and Marma points are thought to be connected to this energy. So now thought to be like, as a Marma vision I told, they are connected. This is from the skeptic side I'm telling that. So that is how we get the Nadi Marma Vijnana. Or Marmas are connected through the Nadis. You have Dvadasha, 12 meridians in the Chinese acupuncture. 12 Dvadasha Nadis are told, Dasha Nadis are told, Dasha Vayus are told, how they are connected, etc. Application therapeutic massage. Marma massage is a therapeutic technique that involves applying pressure to specific Marma points or areas to promote relaxation, reduce pain, and improve overall well-being. So massage therapy is one of the modalities in physiotherapy, is it not? So Marma massage is understanding that there are areas which are Marmas and having that in head and doing the massage. Massage techniques will be the same. You can call it effleurage, petrissage, apportment, shaking, etc. But what the concept of approaching it from the prana point of view, that makes the difference. Marma science is used in Ayurvedic treatment to balance the doshas and promote health and wellness. Okay, next please. Benefits: relaxation and stress relief. Massage can help to promote relaxation and reduce stress. Is it not? Is it not? Yes. Whenever you are traveling somewhere, you got numbness, what you do on the leg? Sometimes long travel, no, during night. You put your leg on the side of this one bar, and once you get up when the bus jolted, and then you get up, then you find that one of your leg is not there. Is it not? What you do generally? First of all, whether the leg is there, you will see. And later, when it is not, again this one, what you do? You do a friction massage. So, you know that the benefits are by improving the circulation, to improving the nervous conductivity, to promoting the lymphatic or resetting the lymphatic flow. You are correcting that working of that the part of the body. Pain relief and then improved circulation. Okay, next. Next please. Integration with modern medicine. Marma science is being integrated with modern medicine to provide a more holistic approach to healthcare. My dear doctors who are on the other field, I will just request that only, how we can integrate and give a better relief to the patients who are approaching. Modern research is being conducted to validate the effectiveness of Marma science and its applications. One application I have already put to Girish sir to make a scientific study on these things. Next. Relevance of Marma science in modern age. Okay, now whether, this sir is coming and talking about Marma, whether it is relevant in this age also. So, many times it was hidden. It was not known. So now we have to see that holistic approach. Marma science offers a holistic approach to health and wellness, considering the physical, mental and spiritual aspects of an individual. Ayurveda itself tells that holistic health is when you have a balanced physical condition, mental condition, and also you are spiritually oriented, means you are you are in homeostasis with the surroundings, with the universe. You realize that in One Health we tell, no, you are only part of the whole world. You cannot be alone well. When the world around you is well, you are also well. So that concept is there And therapy can be used as complementary approach to modern medicines, promoting relaxations, reducing pain and improving overall well-being. Sir, this is one of the areas where if we can reduce the pain medication to half of it, or to start with the pain medication, wean it as early as possible by giving, that's a great blessings for his kidneys and liver. Is it not? Accepted. Stress relief. Marma science can help individuals manage stress and anxiety, promoting mental well-being and resilience. Nowadays I find that who is not stressed? You ask the student, sir, too much to study, sir, I am stressed. Ask the teacher, too much to teach, I am stressed. Ask the doctor, too many patients, I am stressed. Everyone is telling that it is stressed. Because it is, that when what we do not enjoy, it becomes a stress. When what we do, we enjoy, how much we do, it's not a stress. Only thing is that later, when you age, like, you feel that, okay, my body is not pulling me to as much as what I want to do. Like, that's all. So stress as it is mostly, I tell that man-made, created, etc. But it can be managed properly. Pain management, effective in massaging chronic pain, in reducing inflammation and improving mobility. Then pain study, if you go into, I cannot go into now. Pain, you have the acute pain, you have the chronic pain, you have the cancer pain, which is a total pain. So different situations in Ayurvedic persons are very good in handling total pain. They give the advice, they have the time for the patient, they give the solutions many a time. How to manage it, they will tell. There are modalities in Panchakrama which are very much effective in heat and cold applications, like as you do in physiotherapy. In palliative care, that is how you are able to give more things like that. Okay, next. Modern applications, research and validation. Okay, same, almost same only. Next we can go for that. Relationship between Marma science and modern orthopedics. So we have started in Kerala. It is mostly orthopedic medicine with the concept of Marma, which is being handled as Marma Chikitsa. So we can see that many of the patients who are coming to my OPD will be having musculoskeletal conditions, either with there is orthopedic conditions, either with a circulatory problem or a neurological problem, or both associated together. There are situations which come like that. Maybe it is immediate or as a post-accident or post-trauma complication which is coming. So focus on musculoskeletal system. Both Marma science and modern orthopedics focus on musculoskeletal system, including bones, joints, muscles and soft tissues. Now this we can see that even the classification of Marma, when it is told, it will be called Asti Marma, Mamsa Marma, Sira Marma, Snayu Marma and Sandhi Marma. That itself is a proof that this thing, what we talk, is relevant to the modern orthopedics also. Both Marma Shastra and modern orthopedics recognize the importance of anatomy in understanding the structure and function of the musculoskeletal system. Otherwise we casually tell that, but here, as Acharya told, using I was putting a new word. How many of you have heard, Ayurveda people are I'm asking them, how many of you heard Marma scope? We usually use in our practice the stethoscope, we use the microscope in pathology lab, we use the telescope to see the stars, okay? Or many other scopes are there. Ophthalmoscope, madam is using, anorectal surgeon is using the proctoscope. I am asking you, how many of us use the Marma scope? We start from today, 3 o'clock now, start using the Marma scope, you will start finding more things, more this one. So, you know that the anatomy is very important, functional anatomy is very important in both orthopedics and this one. Next please. Differences, approach to treatment. Marma science takes a more holistic approach to treatment, considering the physical, mental and spiritual aspects of individual, while modern orthopedics tends to focus on more targeted and evidence-based treatment. This is the way it can be. Even when healing a fracture, whether there is any importance for you to do a massage, whether there is anything to instill him the hope that he is getting corrected, he is getting, his callus is being formed, he is getting okay, he will be back to normal activity. It's very important because so much of endorphins will be formed which will start healing the patient. This we cannot forget. So our approach is like that. Understanding of pain and dysfunction. Marma science views pain and dysfunction as related to imbalance in the body's vital energy, while modern orthopedics tend to focus on more structure and biochemical explanations. That's the way I can, or we can put it now. You know that actually if pain is there, there is no modern pain, ancient pain. There is no homeopathic pain, Ayurvedic pain, etc. Pain is pain. So how we approach manage it is the most important thing. Next. So potential areas of integration, sir. Whoever is this is the area where we have to think about integrating both the sciences. Marma massage and therapy may be used in conjunction with modern orthopedic treatments to manage pain and improve mobility. Mobility improvement, you know that when the range of movement is affected by the pain reduces, the range of movement increases. You know, so that's how we do. Rehabilitation, again, promoting a more holistic approach to recovery and functional restoration. Prevention may be used to identify potential areas of vulnerability and promote preventive measures to reduce the risk of injury and dysfunction. This is very, very relevant in sports medicine. You can be smart enough to handle or treat a sports injury, but you are smarter if you prevent a sports injury. Because any sports person injured, his performance rates comes down. So that's why they have in every culture, you know that wherever there is this martial art, this one is there, you see that the person who is going in for martial art is prepared first. If you are going to do gymnastics, and if you are thinking that you will turn like Nadia Comaneci or somebody, or our own artists, can we do that? They are prepared for that. Their body is made like that. So, Marma massage and other things are very helpful in such situation. Next, prevention. Research and collaboration, it is needed. That's what we were talking about. That is helped to better understand the benefits and limitations of Marma science in the context of modern orthopedics. Integration into clinical practice, providing a more comprehensive approach to patient care and promoting optimal outcome. This is one thing. Whether usually now what we see, I'm not making an allegation, but many a times you see that you have arthroscopic surgeons, you have meniscal tear, you go and get the meniscal tear done. Job is over, operation is successful. What is the outcome? After that, if he is not properly rehabilitated by a physiotherapist or a manual therapist, what is the effect of the operation? If he goes for quadriceps, you don't do quadriceps strengthening exercises. The whole process of doing the arthroscopy had gone waste on. But sometimes it is a partial tear only. And you did very conservatively managed it and then did the proper post-injury protocol. He may come out without any arthroscopy. So there and all, Marma approach is like that only. For your interesting, I will tell that many of the ACL tear, which are just ACL tear with PCL involvement, directly sent for surgery only. But we have many cases where we have just the outcome after 6 months is as good as post surgery. Okay, so there the integration comes like. Okay. Pain management, improved movement, enhanced relaxation, and it's a holistic approach. Next. Orthopedic and Marma science can be used to treat a range of orthopedic conditions including back pain, neck pain, and joint pain. Okay. Sports injuries. Marma massage and therapy can be used to treat sports injuries, promote recovery, and reducing the risk of further injury. I told that. Marma science can be used as a complementary approach to chronic pain management, reducing pain and improving quality of life. Improving QOL is very important, where the psychological aspect also will come into. So when Marma is talked, what is the Ayurveda definition? Do you know? It is not just the structure over there. That Marmasthana has the Manas Sattva Raja Tamas also there. It has the Bhudatma there, the life force there. So that is why a most important this one of a Marma injury is pain. And pain is a physical symptom? Is this a physical sign? Is it a psychological mental sign? Or is it a psychosomatic? It's a psychosomatic. So approach also needs that. If it is a psychosomatic pain with more of psych into it, you will have to have a psychological approach. If there is a more of soma into it, you will have to have a somatic approach to it. But they cannot be separated out. Masking the pain is it not the way in the modern pharmacology? Mostly it is masking. Masking is a different thing. Like whenever you cannot have that's why I told that tool can be used, but without that, how you can? Okay, I told already. Sports injuries and chronic pain management. Next. Integration with physiotherapy and future directions you can discuss with your head of the department and all. I think Dr. Girish and other people are extending a big hand for this integration, what in future you can do. So those are the complementary therapy in a multidisciplinary approach, which will give, I tell you, more to the future of the health sector in India. You will be the people who tell that, okay, with this Indian contribution into it, I was talking about resuscitative medicine, emergency medicine, that with this input from Ayurveda, India has a protocol for the world. That should be our nature, this one. So there is a lot of rich literature as well as practices which should be incorporated in Europe. That's what I told in that. Research and validation is required, and education and training is this one. Training also, sir was just telling, for Ayurvedic people, for the other people who are doing manual medicine, how we can integrate to do the things. Next. Okay, that is as far as I think. Now, what is the purpose of our talk? You know now. Okay, now we'll go for Marma Vijnana is half of Shalyatantra. Shalyatantra is the surgical branch of Ayurveda. You know that without knowing the marmas, if you are going to do a Shastra Karma, you may end up in difficulties. Remember that when Sushruta was doing the surgeries, there was no proper analgesia. Remember that there was no proper method for loss of blood to be compensated. There was no anesthesia, there was no this potential antibiotics over there. So in that context, you should be remembering that whenever we are talking, then marma were very important at that time. Now even Hridaya, when I tell that, you may ask a question, sir, there is open heart surgery, how it is possible? And if you tell that, if you meddle with that, he will die. But you know that now also it is very critical, is it not? There are some vital points which are very critical. Marmas are vital and susceptible points or areas in our body where prana lies more connected, concentrated. Here I will tell you points are there. Whenever I tell points, I change it into areas because dimension of the marmas in Ayurveda is not just a point. It is an area, triangula, chadurangula, egangula, like that. So it is not a point, as in the traditional Chinese acupuncture, etc. Marmas are jiva dharani or jivasthanas, life spaces. Next, please. Marma should be avoided during surgery. Marmas are even very carefully, whenever any parasurgical methods are also done, you have to be very careful because you may induce pain which will go for pain shock and the patient may die. So, Mareti, the marma, that which kills, when an impact is more, so you can get impacted on your marmasthana. For example, you can have a injury which gives you pain only. You can have a pain with dysfunction. You can have, that is Vaikalya. You can have pain which is consistent there and then it turns it to be a later your fatality is there. You have a chest injury which after some 15 days it becomes fatal. You have something which is immediately killing or within 2 or 3 days you are killed or you die. So marmas are utilized in manipulative management of injuries and useful in martial arts fights for defense and treatment. Like Kalaripaitu and all in Maharashtra, whether anything is there, it will be there. In every warrior force there will be a training center for the warrior to be trained and surely it should be there in Agadas and all. Will be there in Shivaji's place also. And there are some people who are, the only thing is that whenever somebody is doing in a traditional way without the knowledge, And if they are not doing it in the proper way, then we have to guide them and tell them. We cannot discard them. For example, there are bone setters in our place. They don't know that if you do massage on a injured elbow, if you do a massage on an injured elbow, you will go for myositis ossificans. But they will do that, and that patient will come to the modern doctor and tell that this is what is happening in Ayurveda. Because that is ignorance. Whereas a Paka trained Ayurveda Marma Vijnani will not do that. He will not massage at the fracture site. He will be massaging to relax the areas away from that so that mobility can be increased. Okay. Next please. History, Dhanurveda, you have heard Ayurveda is one of the Upavedas like that, Dhanurveda. So there also the integration in Marma Shastra, integration between Dhanurveda and Ayurveda has happened. Okay. Details available from Ayurveda Samhitas, vernacular books and local health traditions, culinary schools, etc. is what I told. In Tamil Marma Chikitsa there are around 350 books, I told. That's what Sir was telling. And there are around many manuscripts, my dear students. Actually, Ayurveda students, I encourage them. Government should have a project on the manuscript library, etc. They should be given a project for transcripting and translating these things, which is very important. Marma Chikitsa is still practiced by local Vaidyas as well as qualified physicians. That's what I told. Next, please. Marma Sharira Vijnana along with Bhagna Chikitsa as in Ayurveda classical textbooks, especially in Sushruta Samhita, Ashtanga Hridaya, Ashtanga Sangraha, Charaka Samhita, etc. Varma Kalai as in Siddha and Tamil medicine. And Kulayana Marmas. These are the Marma, three main Marma schools available in the IKS, Indian knowledge system. So Kalari Marmas, now the numbers also we will see. Next please. Sumru Marane, injury to Marma leads to death or disability. Marma is a site where Mamsa, Sira, Snayu, Asti and Sandhi are present in association with each other. Generally one of the structures being predominant. And that predominant structure, with that predominant structure the area is named, Marma is named. Marmas are seats of pranic current, they are also transmitters. You have to have an idea of that. How important is the fuse in the electric circuit? I think it is the weakest. It will be lighter than the normal wire, because once the voltage increases that has to go cut. It's to save the other things. Stroke, it happens like that. Yeah? But there is you know the transmitters, the power station will have 440 kilowatt or more. From there it comes to 110, then comes to 44. Then once it ends up in our bulb, it is only 110 volt. So there are transmitters also. So in our body there are areas where this is happening. Next please. Okay, this I have already told Vada Pitta Kapha and all are there. Pranavastu means that whenever an injury is happening, which is prognostically most difficult, if it is in a Marma area, then that injury will not heal as easily as in other places, because it is in the Madhyama Roga Marga we tell. Next please. This is the basic numbers, 107 known by 43 names. Marma Chikitsa is not very difficult because 107 Marmas we need not learn. 43 if we learn, 107 is included in that. 108, 96 Todumarmas and 12 Padumarmas. It is much more detailed. It is not 107 plus 1. Namal Marmas are 96 plus 12. Some of the Marma points are similar to Ayurveda Marma points. Okay. Kulabhyasa or coloritic texts tell about 64 Marmas known in 37 names. So how far we know now, regarding Marma Shastra. Next please. Pramarmiyam, Charaka's opinion is of the Shiro Hridaya Vasti Trimarma, which is based on the Tridosha concept, etc. Next please. Surgeon should know this situation of site, size, consequence of injury of each Marma, etc. Surgical and parasurgicals are avoided, I already told. Marma Vijnana is considered half of Shalya Tantra. That also we have discussed now. Next please. Marmas are classified according to the location, according to the nature, according to the dimension, according to the number and according to the effect of the injury of the site. Next please. This is the count of that Mamsa Marma or soft tissue flesh which are there in the flesh are 11 in number. Sira Marmas or blood vessels are 41. Snayu Marmas are 27. Snayu means can include deep tendons, ligaments and nerves also. Some bundles of sciatic nerve, which is like a thick bundle, which is looking like a snail. Asti marma, bones and sandhi marma, joints. So when we are discussing about orthopedic and neurological conditions, we usually discuss about the asti marmas, sandhi marmas and snayu marmas. Okay, this is according to Vagbada. Vagbada, there is a progressive nature in Ayurveda also. By the time of Vagbada, he defined the Damani marmas also. Okay, next. Count is same. These are the Snayu marmas. I think this will be not comprehensible to you, but for the sake of Ayurvedic people here, I am putting it. The Snayu marmas are the following. Next, please. The Asti marmas are the Kadika Daruna, Nitamba, Amsaparaga, and Shanka. How many of us remember these things? I don't know, but let this be an eye opener for you that this many things are mentioned, and we'll come to the clinical situation also. Next, Sandhi marmas are these: 2 Janu, 2 Gorpara, 5 Simanta, 1 Adipati, 2 Gulfas, 2 Manivanda, 2 Kukundara, 2 Avarta and Krikariga. So just to get you, there are names for these marmas. I am telling that. Next, please. Symptoms of each and every, in Ayurveda Shastra, symptoms of each and every marma injury has been described. Immediate general symptoms are told, the immediate symptoms are told, and the late sequel has been described. So that way, immediate the symptoms are in asti marma, intermittent pain, thirst, bleeding with bone marrow, if the bone is cut or injured, open, then swelling, etc. Next, I have not introduced any Sanskrit words because it will be difficult. Sandhi marma, profuse swelling of a joint, hemarthrosis, immediately you fall, immediately you get a hemarthrosis, like immobility, pricking sensation, deformities, dislocation. Next, so you know that in Ayurveda, 12 types of fractures has been described by Sushruta. Sorry, he did not get this one. We know fractures by other orthopedicians' name. 12 fractures. Based on the line of fracture that has been described when no radiology was there. You have 6 types of dislocations which are described. Whether it is lateral, whether it is medial, whether it is anterior, whether it is posterior, or whether there is a rotatory component in that. Whether it is a fracture dislocation. The 6 types are described. So you know that we have to tap whatever knowledge is already there with us when we are discussing that. Next, please. You know that now I am just, for those who are interested, the marma points. This is the Chipra point, this is Snayu, this point. You know that Chipra and the anatomical structures which are coming in that area. So if I go, these are for classes for deep studies, but I am showing that this is thing. I will just show you one thing. Shall we do another practice? Because almost after 40 minutes you know that you go to sleep. So now, you have your hands here. You have the legs also. Okay. What is this? Those who are Ayurvedic people are telling that it is Chipra. Or who have learned modern anatomy? There is a web space between this first finger and the second index finger, is it not? And can you reach the, if you put this one, can you put it a like this one? Now, with the finger over here, back, with this, you slowly give in the top of the summit of this one, there the web space, you go on pressing. What do you feel you do? You go on pressing over here. Somebody told pain, somebody getting any other sensation? It is tender? No, it should not be provoked actually. Marma never told that you should provoke it, but since it is a demonstration, I have to do it. Like, you go on giving it, slowly you will see that your fingers are getting weak. There is a painful area over there. You know the structures are almost same only. No, don't believe me, don't believe the acharyas. I am telling you that give the same pressure in just half a centimeter around it and see whether the pain is same. This is how you will be able to realize that, because the aponeurosis is same only, vessels are same only, the nerve is same only, this thing is there. But when you give a pressure over here, you have some feeling. Pain is subjective. I should not impose that the pain is like that. No, pain is like this. No, you feel. And then you give. Somebody did like this after that. There are people after that. So kindly we tell that to do like that. But did you feel half a centimeter across the same pressure you give or more pressure you give? Do you have the same feeling? No. Shreevaths Marma, no location, no you know. And Shreevaths Marma is almost similar to the LI4 or something point in modern acupuncture, Chinese acupuncture. And this is a very good place for pain management. This is a very good place for pain management. You have it in the leg also. I have a clinical experience where the sciatic pain, they come with, they cannot move the leg at all. They come like that, like our friend who had the he had the Kadigraha leg and will not be able to move leg. They will be brought like horizontal, and then one sitting proper with this Chipra manipulation, you give, and slowly they will listen to you, like the pain will reduce, and then slowly stretch, they will stretch. The sciatic pain will reduce by 50%. You ask them to get up, and at least stand up now. Ask them to put the feet, they will be able. Pain may be recurring, but the relief you give at that time with this one. So Chipra is a very, very, very important point. Chipra is called the Kavalikalam in Tamil Burma, and Adangal, that is one of the Adangal. Whenever somebody is unconscious, for example, I tell that, that's also a hint I give you, when somebody is having epileptic fits, if it is a peridmal, or you are traveling it has happened, the train and all. You travel and then a child they suddenly gets into fits, and then you go, what a Marma physician does, nobody knows that. Go as if you are helping him, put the finger under the blanket, that slowly this one. Because the effect of an injury there is causing convulsion. Wherever the convulsion, so Ayurveda generally does not tell, any text do not tell about Marma Chikitsa that this pressure point has to be pressed to get that effect. But when we know Tantra Yukti, we know that when that is told that it will cause convulsions, wherever convulsions are there, you can utilize it. So that is why I told that Drishta Karma only it will be possible. Everything it's not, in Ayurveda textbook is not revealing the procedure. Even Abhyanga is not revealing the procedure. Okay. So like this I am going to show just for your interest the different points. So this is the Chipra. You have 4 Chipra points, 2 in the hands, 2 in the legs. So now already, rather than Ayurvedic people, physiotherapy people have learned 4 Marmas now. Okay. Next please. So these are the, for detailed classes we will have that. Kurcha Marma. Next. Kurcha Marma is the Kurcha Marma. Kurcha is in
Cartilage.
No, it's told as cartilage. Kurcha, the word in Sanskrit is for brush or broom. So you can see that from here. Can you see the sticks of the broom? Or my hand can show you. So this is the Kurcha. It's a triangular marma over here. All the midfoot pain and all are due to these things. So you have the Kurcha in the hand as well as in the leg. Sports injuries, many happen. Any football injuries can happen over there. So then what happens over there when it is happening, effect of a twisting and trembling of the injured foot of hand. Trembling means stability is lost. When the tendons are broken, when the ligaments are broken, the stability is not there. And Kurcha Shira, next is the junction of this Kurcha. So now I think till Girish sir, there won't be time. So I'll just skip it. Show that and then mention it and go. Next please, there is Kurcha Shiro Marma. Effect of injury, whenever you have a ligament injury, the most commonest injury is the inversion, no? Sports injury, most commonest injury is a lateral ligament sprain, which happens when the inversion injury occurs. Pain and swelling will be the thing. Sometimes you will doubt whether the malleolus has broken also. That much of severe tomato-like swelling will happen and it will be confusing. So, same thing has been told in Ayurveda. Because it's a marmasthana, it is a Vaikalya Marma. Okay, next. Ani Marma, Ani is the Marma 3 angulas above this one, here also. Next. Gulfa Marma is the ankle. Ankle proper is the Gulfa Marma or inferior to the ankle. Now you know that once we study the ankle properly, there are not one joint, there are two joints. What are the ligaments which are connecting over there? This is Sukshma Jnana, like how in the Sandhi, which Snayu has broken. So that gives a advanced knowledge of how to handle that. Even if it is a bandaging technique, in an inversion injury, how do you bandage? In an inversion injury, how do you bandage? The bandage, this thing should be reversed because you have to give stability for that. So core understanding of the problem is needed. With the Marma understanding, it will be very good. Next please, pain and stiffness. Now, for the physiotherapists, my dear students, in your language, what are all the disorders of the ankle? You know that sprain, inversion injuries. Next please. Some pictures I have given for your this one. Next. What is a flat feet? What is a normal feet? What is this thing? Whether I am telling you that all these conditions can give a discomfort or pain to this one. How massage, Marma massage can understanding that Marma areas give massage, that will relieve the pain very quickly. Next. So these are the conditions of the foot. Next please. You know the flat foot, normal foot and hollow foot. This foot and ankle, what are the conditions? Now I don't list it out. Next please. These many conditions can occur in a sports injury also. It will be a waste of time for reading that. So you know that all these conditions, Marma massage can be very useful. These are all orthopedic conditions with sometimes, say for example, we have heard carpal tunnel syndrome. Is it not CTS? How many of you have heard tarsal tunnel syndrome? That also. Have you got patients? Have you got patients? There are patients who are sometimes misdiagnosed as OA arthritis, OA ankle joint, etc. Marma massage and other therapies can relieve it very well. Next. These are all the conditions I have just listed because it will be interesting for you. These conditions are all. Now when we tell about this foot marmas, I told that Kurcha, Kurchajra, Gulfa. What in Ayurveda, only 3 this thing has been told. But what are all the modern conditions which can occur over there? These are the conditions. Like that I will show you in every part. Next. Manibandha. Manibandha is a common all over India, I think. No? Manibandha is Manibandha only. Yeah. Where you do Manibandha or where manis are bandida. You have the what you call carpal bones, 8 number small things which are banded over there. It's Rujagra, very painful. Any fall, any collis fracture, post-collis fracture, you know that you have the defunct, just etc. Just joint ulna. Okay, next please. Disorders of the wrist, synovitis, carpal tunnel syndrome, Dicker veins, wrist drop, ulnar drift, what do you call this one, radial drift, everything. Next. So you know that these deformities are difficult to even, you have to go for thorough panchakarma therapy and other things, but pain due to that can be managed. Next please. Trigger finger, swan neck deformity, buttonized deformity, where surgical you have a predominant predilection for diabetes. You are diabetic, somebody is coming with trigger finger, you operate on that, next after 2 months another finger comes. What you will do? So many these ones are there. So we have seen that with Gandha Taila or Chirabala Taila or Vatahara Taila or Ashavanna we call in our this one, which gives space for that. You do massage, done. So that is the thing. Next. Clunkes, palsies, other conditions. Next please. So in wrist and hand, the sports injuries which can all come like carpal bone injuries, game kickers, thumb, hamate fracture, all these conditions. Okay, next please. I can give this slide, no problem. All the metacarpal fractures, dislocations, scaphoid fracture. Scaphoid fracture will go, an adult falling on this thing, he suffers a scaphoid fracture. Nothing is there, usually nothing, but it is a site for avascular necrosis. So you know that after that, it will go for OA, there will be a persistent nuisance pain. Whether Ayurveda can do anything, so sometimes it is removed off, that is the thing. Whether Ayurveda can do anything, okay, there is a Chalasandhi, if you give a Piju Bandhana over there for a long time, the pain will slowly decrease, and then Asti Chaya Hara Chikitsa or Asti Vruddhikara Chikitsa can be done by the Tikta Chira, this one, etc. Very good results you get in avascular necrosis of the neck, of femur, in these conditions, etc. Okay, Decker wines and all, you know that the Viddha Karma, Agni Karma and all are very giving good results. Next, Janu Marma, knee joint, the most, we tell that is the thing which feeds us a lot. Because everyone has being bipedal animals now, we all have knee joint pain, we have all the knee joint, after 67, 60, 65, you have anyway a degenerative change occurring over there, which may be increased by your activities, which may be increased by your bone mineral density loss, whatever it is. So that is again, now for one example I tell you that in Tamil Varma there are around 6 Marmas told in this area. But that is why I told that Janu Marma, when it is told, it is again told that it is a triangular Marma. So from the midline, you have one angula above, one angula in the midline and one angula below also. Think of all the structures which are coming over there, all the intracapsular structures, all the extracapsular structures which make the knee joint comes there. So the whole thing is dealt in one aspect of Janu Marma Abhiveda. This thing is that injury, lameness. Whenever the knee joint is injured, you get lame or limpy. Next. Disorders of the knee, stiff knee, contramalysia patella, sprain, twisting injuries of the meniscus, IDK we call, internal derangement of the knee. Next. So many conditions. So you know that. Next. Calf muscle. So it's part of this one also. From the knee to the calf, you have all these conditions. Shin splints is one of the conditions in the runners. You got the runner's knee also, shin splints also. So where good Padahara Taila Abhyanga itself will be a good thing. If you know the Marma points, Indravasti Marma is there, you do that, immediate relief will be there. So in sports Ayurveda, we had been 2 running, they will do. 3rd attempt, they cannot do. Immediately this is done, and 3rd attempt, they get ability to run. So next, these are all the other conditions. Next, Orpara Marma is the elbow joint. There, you know that deformity will be occurring. It's a very notorious joint where loss of function can occur, stiffness can occur. Okay. Next, I just wanted to know to give across to my sisters and brothers in the modern physiotherapy that these many matters have been discussed in Ayurveda, and these are in practice also. Whereas that information will not be there with you, so that is why I'm giving it to you. Now, tennis elbow and golfer's elbow, you know? You know it, no? Okay. Epicondylitis. Next. These are in the upper limb, what all, including the ulnar nerve entrapment or tardy ulnar palsy, etc. So, imagine that when I am telling this, we have, when Girish sir introduced me, but I do not put me alone, because there is a big team of our Marma physicians who are always interacting. If a case comes here, I don't have a solution, I call Dr. Suresh Kumar, I call Dr. Jain, I call Dr. Matthews. We confer, because Vaidya Samoho, he, Nisamshaya Garanamstation, cross reference is there, cross consultation is there, and then we come to this one. So whatever I am telling is the product of such discussions also, not my contribution alone. So you know that Amsapalaga Marma, this is quite an interesting thing. A patient comes to your clinic. He tells that since 1 week I am observing that when I remove the shirt, I feel that the muscles are wasted. And I am slowly getting trouble of lifting the arm and this thing. What will be that? You ask for the history. And you tell that, or you are asking whether you had an injury every 3 months back or something. And he tells that, I got a hit in the back. Or when I was climbing upstairs, this one was there, I hit it over here. You can see the lakshanas are numbness and wasting of the upper limb. So this much of anatomy has been told. If you get an injury in the Amsapalaga, and if you get an injury on the Amsa, your arm muscles will go for wasting and you will not be able to function the hand. So you can very directly ask that 3 months back whether you had such a situation. So that is the thing. So that aspect also we have to understand how clinically it is related. Next please. This axillary nerve injury Keralya Marma again. Then you see that the people who are walking using the crutches, crutch palsy it is called. Get into crutch palsy. Paralysis of the limb. Next. Namsa Marma. Now just one more this thing I tell that if you can everyone do this, you take your hand like this, keep it on your shoulder, the neck, and the middle finger is there, no? You keep it like this, and the middle finger you press there. You get a painful sight? Namsa Marma. Same, you make it into 90 degrees and reach above the spinous process of the scapula. There you press, you will get the arms roller. Again you take it down and then you will get the breath. Next please. So these are the cervical pain conditions which are painful, which can be dealt with Marma therapy. Stingers and burners. What is stingers and burners? Plastalgic pain we call in sciatica. Like that, as if scorpion sting or bee sting, like this one patient will be telling burning pain with radiation. Okay. Next. For every case is I am telling you that we have made some protocol. Whiplash injury, how to deal. This one, how to deal. And all these things, how to deal. Because the protocol is there traditionally also, with the knowledge of modern medicine also it is there. Okay, frozen shoulder or periarthritis, shoulder problems, supraspinatus tendinitis, and recurrent dislocations. Do you believe that dislocations are handled by Ayurvedic people?
No. we never heard of it.
If there is an anterior dislocation, even better methods than Cocker's method are there. Better method than Hippocrates' method are there. So I am telling you, it's something which is currently available, relevant. Only thing is that has to be taken across to the practicing people. Next please. These are some pictures which give you this one. Next. Painful heart syndrome. Supraspinal calcification. Calcification, you cannot remove the calcification, but you can make the situation better for that patient, painless, etc. Next. Drop arm syndrome. What is drop arm syndrome? There is the ligament which connects the clavicle to this one is this one, and the arm goes for weakness and the drop. Okay, shoulder impingement syndrome or the painful arch syndrome. You would have heard, no? All these things can be dealt with. Next, one thing I tell you, patient coming with periarthritic pain only or any pain not able to, if there is a supraspinatus tendon rupture, then it is difficult to lift it. Otherwise, any patient who comes, at least we can, the first sitting, we can give at least 20, 25, up to 80% mobility for abduction and flexion. Just, you know that, when you know the Kachatrik point which I told, the Bahavi point which you told, and the this point, Chipra point I told. You manipulate on that, immediately you can get the result on the table. So that much powerful is the understanding of because you are correcting the pranasthana. So beating around the bush, you are going to the point where it is crucial. And then, for example, in physiotherapy, you will be doing the subscapularis release, is it not? You do it, no? You release that. If there is a trigger in this trigger usually happens on the Marma region. The trigger you will release. And then the movement will be restored. So these are the other shoulder conditions. Next please. Frozen shoulder. Chest and abdomen conditions also, rib fracture and other conditions which are leading to. Next please. Now Nitamba Marma, back marmas, the Nitamba Marma. Next please. Katika Dharana Marma, where again these are the points related to the spinal cord or the vertebral column. Next please. Mukundara Marma is typically the sciatic area where you get the both sensation loss as well as motor loss of the lower limb. You know that you have a case of L4, L5 disc prolapse, long standing, the patient slowly gets the limb weak. And he has always a abnormal sensation in the feet, paresthesia feet. Same thing has been described over here. Next. So these are the different back conditions. You know that cervical, dorsal, lumbar, lumbosacral, all these conditions up to coccydyma. Next. Thoracic disc. Next. Thoracic outlet syndrome you would have heard, no? Thoracic outlet syndrome. So disorders of the spine, IVDP, degenerative DDD, spondylolisthesis, spondylitis, ankylosing spondylitis, etc. My dear ones, I tell you that whenever somebody is having a disc prolapse, the modern orthopedician tells that don't. But when he comes to an Ayurvedic physician, Ayurvedic Marma physicians, we will make that you bend forward, but don't get pain and also when you prolapse. Guarantee. Because you know that you don't find the disc alone. The behavior of the disc is by the surrounding tissues. So once you relax the muscles, paraspinal muscles, once you strengthen the ligaments over there, it does not harm. Without that, that is one point I will tell you, my dear physiotherapy students, that the importance of Snehana and Swedana in Ayurveda. With that only, the structure will become pliable. Otherwise, in a painful patient, if you do that exercise, that pain will increase. But if you do some heat therapy and then improve it and then do it, condition it and then do it, it will be. Next please. Dorsal spine conditions, scoliosis today, then she told that. Next. Mechanical or lumbar back pain. Next please. Next man. These are some of the spinal compression. We have enough of evidences, usually in our clinics, when they are diagnosed with IVDP, then surgery is suggested. When they are directly in Kerala, if they know that a Marma physician is there, they directly go to him. Ask for me every day there will be at least one or two patients going on the way to this one, coming and asking whether this can be solved or whether we should go for surgery. Almost 90% of the cases have been, except when there is a severe cauda equina lesion, we ourselves tell them, no, don't stop here, you go get it done. But some of the cauda equina lesions, without any this thing, that we are able to manage even. Without any this thing, and now we have patients who I have practiced 30 years. We have patients who are coming 25 years back. I came to you, sir, now perfectly fit. After that, no recurrence. So you know that how wonderfully it can be treated. These conditions can be treated. Next please. Hip conditions. Next please. Perthes disease, avascular necrosis. Next. Neuralgia parasitica. This is also another thing. This pocket, you know that you get the musculoskeletal nerve paresthesia. This also good lumbar and this massage will help a lot in relieving these conditions. Next please. Okay, hip conditions. Next. So we have enough of, for a month class there is stuff. Shanka Marma, now we come to the head and neck. Shanka is the place where, when I asked you the first question, when you get headache, the temporal area where you put your hand, that is the Shanka. Now you can put and feel whether there is a pulsation over there. Just keep this one and see whether there is a pulsating feeling over there. That pulsating area is the Shanka. Now that, okay, next. Vidura Marma is, now I tell you that Ayurveda, don't take otherwise mistake, I am not questioning the practitioner, I am not questioning you, but have you ever thought that the 12 pairs of cranial nerves have been described in Ayurveda? Even an Ayurvedic graduate will say, oh, I know, sir, oculomotor, olfactory, optic, oculomotor, 12 pairs. Same pairs have been almost similar. This thing has been told in Marma Shastra. Vidura is the auditory nerve. Are there, how many numbers are there? 2 are there. Avarta and Abhanga concerned with vision. Neela and Manya concerned with hypoglossal and glossopharyngeal taste and vak pravritti. But you ask an Ayurvedic person also. So my professor went to one college, it seems, and they asked, she was in Shalyatantra, no? So that candidate, he asked, it seems, that have Acharya Sushruta told anything about this? Then our attitude, Ayurvedic people's attitude is that she very, very naturally, Sushruta might have told something. So then what subject you are studying? You are studying Sushruta, no? Or you are studying about Sushruta? Now we are all many a times studying about Ayurveda, not Ayurveda. About Marma Chikitsa, but not Marma Chikitsa. So there, if you search, you can see that Fana, olfactory, 2 number. Just for how much rich we are, we don't know. It is like in Kannada, they tell that you have butter in your hand and go and search for ghee all over the world. Chiropractic, osteopathy, this one, what you call deep fascia manipulation, trigger point release. I'll show you what we do in this. Next. So I think this is Utsheva Marma, where you have the every animal which has a horn, that portion. You know that where the hairline meets this one. You know that whenever a puja is being done, first this thing is done over there. Shuklam Bharadaram Vishnu it will be. Why? It is invoking the pranic energy, that Utsheva. Every word which has been used as a name for the Marmas also has meaning. I did not tell about that because it's a small Ayurvedic crowd, bigger this one. Indravasti, one Marma is called Indravasti. It is not leg 2, leg 4, leg 5 point. It is called Indravasti. Why it is called Indravasti? So everything has a meaning. Okay. Simanta Marma. Simanta, because Simanta Rekha, you know it. Simanta Marma, 5 in number. And here you can see that Dr. all head injuries are described in that, because concussion, contusion, which leads into this one. So death may be there, death by madness. So they described it as disordered behavior as unmada, and then fear and loss of senses, and consciousness and comatose situation has been mentioned. Patient is having eczema on the leg. He is advised Shirodhara with Takradhara. After Shirodhara with Takra in the Murda head, his or her eczema is disappearing. How do you explain? With just dosha principle, Pitta has reduced, Rakta has become Shuddha, etc., we can tell. What is the clicking point? How do you deal with the prana over there? How do you deal with the sadhaka over there to correct it? This we will understand when we are treating. We are treating many thyroid conditions. If every thyroid condition can be given, what you call only Varnadi Kashayam and Kanchanara Gugulu will do the job. Proper Ayurvedic understanding will be required over there. Next please. usually deals with the acute. Sir, this is a definition we have ultimately coined, or I coined, and that is published in the CCRI's book also. Marma Chikitsa, for all practical purposes, can be described as deals with the acute clinical traumatic situations with methods advised in Sadhyavarana Chikitsa, management of acute injuries, Bhagna Chikitsa, fracture treatment, and Asti Shofa Chikitsa, management of traumatic swelling. All these are used in Marma Chikitsa. Next, Vata Vyadhi and Rasayana Chikitsa are important in that. Next, the Marma patients have adapted to different varieties of massages in different clinical situations based on age, strength, and need of the patient. Every time you cannot have the same massage, same count, same pressure, same rhythm. No. Rate, rhythm, count, force, structure involved, manipulations like traction, etc. makes the difference. Is traction mentioned over in Ayurveda? Traction, sir, it is a physiotherapy method. Traction, they put traction. Bhagna Chikitsa, first thing is that Siddhistavanam Anchanam, pulling. When it is, for example, when there is a little slip of something, dislocation, it's pulled and corrected. So traction is one of the methods. Next. Longitudinal strokes, transverse strokes, circular strokes, semicircular strokes, etc. Next. Rate, rhythm, pressure actually makes the difference. Next, please. Scope of Marma massage. This also is a definition which has been put. Sir, I think I should get feedback from people like Greece, sir. Marma massage deals with all traumatic and repeated stress injuries of the marmas, acute or chronic musculoskeletal conditions predominantly, involving or not with circulatory and or neurological complications with the patients. There can be, because in a Sandhi Marma, Snayu is there, Sira is there. Or even if you predominantly call it a Snayu Marma, there will be involvement of Sira there. A Mamsa Marma will be there, in which, for example, many of the patients coming with cervical spondylosis diagnosis, surgeon is here. There we find that it will be only the Mamsa Marma, this one which is, and there is no, this is not a culprit at all. But the presentation is paresthesia of this thing, pain, etc. The send for MRI, you find some little, this one over there, but it is minimal only. Doctor himself is not convinced that this is the cause for that radiculopathy, but still sometimes he will be put in for surgery. Whereas it will be entrapment over here, where due to the pressure of the swollen muscles which has gone for fibrosis, fibromyalgia, it will be the thing. So there and all. So that's why we have made a definition like this. Next, please. Factors determining choice of treatment, again I told, no? Build, strength, occupational or not, ambulant or bedridden, location, etc. Next, please. Depends on age, accurate diagnosis, level of tissue damage, grade of neurological or vascular involvement. Everything cannot be treated by Marma Chikitsa also. We call it Marma Upata Abha when it is a small injury, which can be recovered. Marma Upagada means the whole structure has been lost. A nerve can be nerve injury, as sir will tell that. It can be a neuropraxia, it can be a axonotomesis, it can be a neurotomesis. Is it not? Depending on the grade of the injury at the peripheral nerve, the treatment will be planned. Is it not? Some is neuropraxia automatically recovers. Sometimes you leave it there and all. We help to hasten that process. If it recovers in 2 weeks, then our involvement will make it happen in 7 days. So that is next. This is again for Ayurvedic. This one up to of the Shashtir Upakramas. These Upakramas are very important in Marma Chikitsa. Agni Karma, Vidya Karma also has come to now. Marma, Vidya Karma, Marma, Agni Karma. Everything now. We have the latest book by one of the teachers from my place. He is also a youngster. Ayur Cairo Marma Therapy for that. So he has incorporated chiropractics also into it in certain cases, and then he brought out a book. Next. So here generally this is the thing, for practitioners' sake I have put this slide. I classify it as acute, subacute or subchronic, then acute upon chronic, and then degenerative. So our treatment always, the medicines will be planned accordingly like that. Next please. Okay, next please. These two slides. Repeat it. Next. Now just we will finish it off. After this I have spinal kinesiology also, which we will not talk this one. This is now just demo of the methods which we are doing. You know that generally the Marma physician will become the therapist. You know, the patient comes. No other, usually even the Panchakarma people will not go into the Panchakarma room, I think, except when Vamana is being done. But Ayurvedic Marma people will be always, we are ready, that's why we usually wear a slack only, and then ready to put oil on our hand. Okay. So this is the pressing or stationary kneading. Next, you have the peripedonal compressive kneading over there. Next, Samvahanam, that is the palm arm stroking. The Samvahanam is also a method taught in Ayurveda. Next, by finger stroking. Medial side is more tender, so you use the finger for that. Lateral side you can go with the palm. Next, Thadanam is beating. You don't know. Whenever you are feeling numb, what you do? You do Thadanam. Next, so that, see the Vata, when it is slightly disturbed only, you need to give a small massage only. If it is stuck over there, you will have to move it. So you will have to have a Thadanam. Next, Mushti Thadanam, Uddarshana, Karshana, friction massage, opposite side. Udvartana. Next, Talodal is gentle massage. Next, Sandamsham is grasping. Next, Udvartanam, you know that, with the hand opposite direction with friction you do a massage. Medasa Pravilayanam. So in that word for Ayurvedic people I tell that Udvartanam. Vartanam. Vartanam means Varta Harshana Darshana. Vartanam, there is a circulatory movement should be there. It is not just this one. So when fat has to be dissolved out from the fatty area, it should be Udvartanam. So word itself gives a meaning. Next method, Anchanam, pulling. Next, Mardhanam, squeezing, kneading. You squeeze and release. Squeeze and release. Next, Vimlapanam. Vimlapanam do you use in our treatment? Only in Vranashofa it has been told. But wherever there is a Katina, Mamsa, this one, fibrosis, which is forming, that is why that trigger point release and all. Angushtayana, Talena, Venunava. You can use a rod also, reed also. Or chapati, this one also can be used. Or Vimlapanam. Next, Avapedanam. Now my finger is in the Indravasti, my other hand is protecting the Janu. So when you have this Marmascope only, all your hand movements and all will rhythmically come to that. Next, Marma Alutal or Marma Press, which I did for him. Next, Akshara Thirumal is without moving your hand, you are writing letters on this one. So the pattern of movement is given. Like if you I don't know, in Marathi if you have to write Ma, then like that it is made. Next, Kattal is hitting. Whenever it is force is not enough, you use this one, you use the knee. Next, Korparanadam. Yeah. Hitting with the elbow. Next, Irkal or clinching and lifting. Again I showed that. Next, Murukkal. Murukkal is you hold it and then big muscles you can do. Hold it and then next. Idathal is, this is very comfortable, do you know? My dear, you can try. Whoever is coming with the plantar fasciitis and other pain, no? You put them like this and then the tendocalcaneum will be there. If there is no inflammation and all, you just massage over there and give a pull over there and then do the dorsiflexion, plantar flexion. He will thank you. Next. Because there we are dealing with the Indravasti Marma, we are dealing with the Gulfa Marma, we are dealing with the Korsha Marma. This jnana should be there. Next, listen, this one. The previous one. And whenever you are going to sleep, if you are feeling very tired, you may sleep. If you are not and not getting sleep, this is the best thing you can do. Put your leg over there, then give a good massage of your leg with both the hands, and then go for the other leg, and you know that you will get a good peaceful. But for the musculoskeletal physical therapies and all, I will skip that. Your teachers will teach you anyway. Okay. So Kalari massage procedures, that's what I told. All these things are told, but many times, being an Indian, I am proud to tell that along that we don't have a Krishnan's method, we don't have a Raman's method, we don't have a Girish Sar's method, we don't have a Shreevaths, because nothing is published. Experiences are there, it's not published. So we have, actually, doctor, I will give you an example. This is Keralya Marma, supracondylar fracture with kinking or with rupture of the brachial artery. We know that it goes for Volkmann's ischemic contracture. Who is the first person who described it? Sushruta. We are not now also proud enough to tell that Sushruda's contracture. We study it as Volkmann's ischemic contracture. The same thing, Keralya Marma Chikitsa, it will lead for Kunitva of the hand. So I think I was able to convey that how much richness we are having, and when we look into it, how much we can learn. So, Kalari massage procedures also. Next, please. Spina canal-Schulze, I am leaving it. Interested students, you can go through spinal kinesiology and this one. I think you study it as a part of this one. Okay. I will stop with care of the marma. Abhada varjanam nityam swastavrattasya anuvartanam utpannarthi vikaranam marmanam paripalanam. For a marma physician, actually for an Ayurvedic patient, what he is doing through dinacharya, through the swastavrata, etc., it is told in Charagasiddhi 9th chapter only, is marma paripalanam. Because morning we had a discussion. Marma is pranasthana. I am a prani, you are a prani. Protection of the prani is an inherent nature. Whenever somebody is coming to hit you, what you do? Somebody is directly coming, and what you do? Do you move away? Do you put your hand? That is your nature, to protect the prana. So marma paripalanam is also that only. Nityam swastavrattasya anuvartanam, Ayurvedic people know, it is telling about the daily regimen, the seasonal regimen, what all we have to do, that you do. You know that in the summer do you wear woolen clothes? No. In the winter, do you wear just very light clothes? No. So whatever has to be done in whatever season, that has to be done. Whatever to be taken, why you take Tilaguda during this one, that is important. Why you don't take sour material during one season, that is important. Why do you cook one thing in one material only, that is another thing. So Mahara, Vihara is very important. Utpannarthi vikaranam, whenever a disease is coming, immediately treat it. Especially the Trimarmasthanas, if it is a cardiac disease, if it is a Shira disease, if it is a renal disease, because these are the three things which makes the functions properly. So, Utpannarthi vikaranam, whenever it is there, even so, there we have to think that Maranam is told in Marma. It can be of the Maranam of a few cells in the tip of this thing, gangrene. Because Jivana, Prana is not there, it dies off. When the cells of the cartilage, it wears off, it dies off, there is death only. Janu Marma, osteoarthritis, Vedana, dysfunction. So Marma need not be related to just thinking it is an odd thing above, not described in Ayurveda. It is Ayurveda, into Ayurveda, within Ayurveda. Okay, Marmanam Paripalanam, that is the thing. Next, please. Marmovijanam, to become a better equipped Vaidya. Anytime I am available, this is the number. I think there won't be much time for interaction. If there is, I am still there. So otherwise, you can put, because I can suggest some books also. And this is my humble place. I am a farmer basically, and agriculturist. That is the thing, and that is my place where the finishing school, relearning of Ayurveda. I have a small school where away from the college where Ayurveda and Marma Chikitsa can be learned. So next, in that I will tell that ignite, inquire, invest some time, involve and imbibe the Marma Shastra for the greater, to be a proud, very proud Bharatiya in pride in the Indian knowledge systems, and then take it to the humanity wherever it is in the world so that they can be useful in that. Next please. Yeah, this is of a thank you. Welcome to Uncover. Many times students, I tell that in the college what happens is that there is a syllabus, is it not? Teachers are there, no? Excuse me, madam. There is. I started as a tutor. I ended as a director of the college. So I know that there is a syllabus which has to be covered. The principal calls and asks, teacher, whether your portion is covered. So I tell that after your studies, at least during the internship, there is a intentional uncovering to be done. What you studied has to be uncovered, and that uncovering will make you discover many things. So this is the way we have to do it. I'm very happy to introduce, this is my mentor in Kottakkal, Dr. G.S. Raju. He passed away a few days back. This is of the RAV workshop which he inaugurated. That is the person there, you know, all know, I think, is the MP of the land room. And near me are my colleagues, Dr. Vinod Krishnan. This is Dr. Suresh Kumar C, who had been Pune and all, Dr. Jayan, Dr. Saifuddin, and all of them. So we have a bright future for Marma Therapy to be introduced to. I believe that each one of the Ayurvedic Christians, if they are empowered, at least by the knowledge, or ready to open the Marmascope and see the man in front of him, woman in front of him, the ailing one in front of him, the one who is suffering in front of him, he will be able to do that thing properly. With those words, I think it's time up. Otherwise, there are some massage videos and all which will be looking very crude for you, but it's it has saved many of the patients from the scalpel. So with those words, I thank for the opportunity, and Tushajam Sadhurtanam Badram Agamasalinam Abhyastakarmanam Badram Badram Badravilashanam Sarve Bhavantu Sukhinah Sarve Santu Niramaya Sarve Badrani Pashyantu Ma Kaschid Dukkha Bhoi. Thank you very much.